So, this Sunday is the Star Awards, right? Yeah. So it feels a bit surreal to hold a real trophy like that. So thank you very much once again for this award, because I think in my entire life, I will not be having any Star Awards at MediaCorp, right? So thank you very much once again. Yeah. So, we are here in T-shirts, and in fact, we have a lot of us around here in T-shirts. So yesterday, I didn't just come out from the clinic, right? Because it's healthcare beyond the clinic. Yeah, so I didn't just come from the clinic. But in fact, last night I was wondering, looking through the wardrobe, what to wear. Really wanted to be like you, wearing a jacket. Yeah, it's very cold. I feel like I'm wearing a singlet in winter currently. It's dry fit material. But I thought it was important for us to represent the practitioners in health and social care, just like my colleagues on the screen over here, Carol and Jackson, well-being coordinators, and the reason why we need these maps for health and social care practitioners that actually do the last mile in terms of health and social care. So today I represent the business use case in terms of healthcare, how we bridge health and social care. And before I move into further, let me introduce a bit from where I am. I'm from SingHealth, and this is for those who don't really know much about healthcare. We are one of 3 public healthcare clusters in Singapore, and we take care of the Eastern population. So that's about 1.5 million. And I'm over here, one of the 11 institutions in SingHealth, SingHealth Community Hospitals. So this is us, right? And we've got 3 hospitals across. In fact, so we've got Bright Vision, who has actually been transited into a COVID facility, and then Sengkang, Outram, and in 2030, we've got the Eastern Community Hospital. In fact, tomorrow is our groundbreaking ceremony for the Eastern Community Hospital. So all that adds up to about 1,200 beds. So it means we've got scale and also the economies of scale to actually reach across many patients in a community hospital setting. And this is the vision and mission of my organization, where I come from. Yeah. So it's to deliver person-centered care to achieve health goals with our patients. And why is this important? For those that are very new to healthcare and may not exactly know what are community hospitals, I thought maybe I'll share a bit more. So over here in this graph, you would see that for community hospitals, we bridge the gap between an acute hospital and what you know as a general hospital. So a general hospital is an acute hospital, and this is where usually you stay, okay, not you, or maybe somebody else, okay, right? Stays about a length of stay of about 7 days. And then they would actually convalesce or recuperate in a community hospital before going into an institutional setting. Say, for example, a nursing home, or maybe going back to home. They stay about 26 days, right? So that's a pretty long time. And the age profile that we have over here, as you can see, is 75, 76, a very old population that we're looking at, who stays a long time with us, right? A very long time with us. So what does that mean for all of us in community hospitals? We've got that window of opportunity to spend the time with these patients. And because they are old, there would be many complex issues, not just medically, but socially. So do we then just administer medicine? Or do we need to look at a more holistic well-being feature like psycho and social models? And this is really important for us, and I'm very glad that Dr. Victor Khoo earlier mentioned about Sustainable Development Goals, because indeed, our UN SDG 3 is about ensuring healthy lives and promoting well-being across all ages. Yeah. So this is a model that is not just from us, but in fact it's also actually encouraged by the World Health Organization. So over here, if you can see, these are what we call social determinants of health. And how do we address person-centered care at SingHealth Community Hospitals is through this model that's called social prescribing. And the definition of which is actually in the green bar over here, is addressing social determinants of health through this model that we are called social prescribing. And these social determinants are the conditions in which we live, work, and play in, right? So 2 patients, exactly the same, having a need for total knee replacement, which is a very common condition and a diagnosis for which people come to in community hospitals, right? But if one has better social connection than the other, one has more income than the other, one has more family support than the other, surely the two must recover differently. So it is important for us to address these social determinants, or some also call it social inequities, for them to level up in terms of their outcomes. And this is truly important for us to do so. And how do we do that? It's actually by going beyond this entire biomedical model of care, focusing on well-being and psychosocial model, not just the biological aspects of it. So as I mentioned earlier, we've got 25.8 days as an average length of stay. We take that opportunity to actually go through the patients in terms of activities, build a very natural social environment for them to interact, for them to engage each other, foster social connections, and really just engage and prevent themselves from getting perhaps even delirium if they stay in an inpatient setting for too long. And is this a panacea? No, this is not a panacea and a Pandora's box to be able to solve everything, but social prescribing is there to complement the clinical prescription. So in terms of psychosocial care, it complements the entire the biological aspects of it to make sure that the person recovers holistically and is person-centered, not just patient-centered in nature. And this is not something that I said it, our organization said it. We've started this early. In fact, we've started this since 2019 July. And this was even reinforced by Healthier SG, right? So when you take the trains, you see a lot of posters in media, whether it's in terms of radio or TV, there's a lot on Healthier SG. So one of the 5 elements, the whole tenet about Healthier SG is about one family doctor, one resident, one care plan. But one of the core tenets of it over here is you can see that is on social prescribing. It's community partnerships for social prescribing, and it's about partners working together to support healthier lifestyles and outcomes. A bit about my journey as to how we started social prescribing was that when we were looking for a model of care that embodies the mission of us delivering person-centered care with our patients, we went to the UK to learn about social prescribing. So even back then in 2019, they've already had it in their national health policy to be able to dole out social prescribing. So we went there in a journey to learn more about it, and we took back and implemented. So after that, we were privileged to be able to work with many people, and including WHO, where we produced a social prescribing toolkit on this area. And WHO has also ascertained and validated that social prescribing is a key pillar in the world, in the part of the world that we are in Western Pacific Region Office. We've also done some work in advocacy in Singapore to spread the word about social prescribing through conferences and through masterclasses. And most recent, we've also had an op-ed article in Straits Times by our CEO and Deputy CEO. And these are really articles that we only see in The Guardian earlier, not in local media. So very encouraging to see that healthcare is taking a very holistic approach in terms of health and social care. And to see that art therapy, befriending services, doctors should indeed prescribe this as part of social prescribing and Healthier SG. So let me talk a bit more about the social prescribing process that we take in SingHealth Community Hospitals. So across the 25.8 days that I mentioned, what we start to do first is that the WBC means well-being coordinator, not white blood cells, all right? So well-being coordinators will engage and screen patients' eligibility. So for example, if the patient has significant sensory impairment, cannot hear well or cannot see well. This is an example. It would be difficult for them to engage, but we will still do activities, right? But the end goal, as you can see over here, is actually for us to be able to link patients to a community asset that would be able to motivate the elderly patient on a daily basis, having a purpose in life and something that would stay active in the community. So after engaging the patient, ensuring that the patient doesn't have any inertia or resistance against the well-being coordinator. The well-being coordinator builds relationship and trust with our patients, identify needs, and encourage the patient through the activities that I shared earlier. And then they co-curate the social prescription plan with the patient, right? So they identify and connect with community to support and also look for activities for them. They link patients to community partners, and then we follow up with patients post-discharge. So in the blue box that you see, this is where a map would be very useful, right? In terms of linking assets. And, you know, it's not just about the asset being an asset. It is the route there. Is there going to be barriers? Is the patient ambulant enough to get there? Is there anybody bringing them over there? So there are a lot of considerations in a map, not just looking at where is the place and then looking for public transport for that. A bit more on our well-being coordinators. So this is us, right, over here. A lot of them are mid-career conversions, right? So we've got forex traders, we've got ex-professionals who are MBA holders, we've got ex-chefs, we've got ex-administrative staff, a very different and very diverse batch of people who found their calling in health and social care, who came to us, who trained to be a non-clinical workforce to support the clinical prescription in terms of social prescription. So as of last calendar year, we've screened more than 3,000 patients for our social determinants of health. If you were following me earlier in my presentation, these are the conditions in which people live, work, and play with, and with enhanced supervision by the medical team as well. So when they look at the part of the social prescribing process to be able to connect community assets to the patients, an asset map is absolutely required. It is critical for them in this part of co-curating the social prescription plan with our patients. Here we are in Singapore, right? So a week ago, we know that 2024 Smart City Index, we are first in Asia, fifth in the world in terms of smart city. So we are well endowed in terms of consumer maps. We've got wonderful, fantastic agencies like Health Promotion Board who gave us H365 maps to find out where is the nearest Zumba, where is the nearest Tai Chi classes. So these are absolutely fantastic, right? We've got assets already readily mapped out for us in terms to support healthier SG. And when we started out the work with SLA, we've also used one map. So over here you can see this is the base of one map providing us with assets. For example, where's the nearest community clubs or libraries in terms of assets on the mobile app editor. So this has been useful. However, when our practitioners, right? Our practitioners, and not just me in an orange t-shirt, we've got many others, because in Healthier SG, it means that there will be active aging centers in blue, in pink, in red t-shirts, many other t-shirts, practitioners in health and social care that would want to document their journey, right? Because they would be going through questions like that. What programs are there in these assets? Are there charges for these programs, right? Because this would either make or break the social prescription plan. And when I get to know some active aging centers, we realize that, hey, this guy is really helpful. Should I actually put him on a map and say that, you know, this is a wonderful person to talk to. If you want to go to XYZ Active Aging Center, please speak to Ellen. So this is something that we should document. And then also this is, you know, there are some assets, like for example, community gardening. And why is it important? Because this improves the dexterity of the patient's fingers, right? So all these are useful, and we do not want to waste any community walks or any community audits and waste the terrain that all our practitioners have walked on. This should be mapped and should be institutionalized as knowledge for other practitioners. And even more so, what backs this up in terms of a theory is actually the asset-based community development. So this is the reason why I say that it is for practitioners by practitioners. Because the ABCD theory actually supports this, because the most sustainable thing in the community is something that is for us, by us, right? And the consumer maps that I've shared earlier is actually at this base over here, where the rate of change is relatively low. But when you move up higher, in terms of associations and in terms of organicness, in terms of activity, the rate of change is higher, and hence it is important for us to map this down. So all in all, we've had a problem statement, right? And it was important for us to look at a practitioner-facing map, and how do we then able to map with other wonderful and existing consumer maps that's really out there. So what we did was that we worked with other agencies to complement the strengths that we had. So we've got MCCY, we've got a colleague from the Ministry of Culture, Community and Youth today as well. So we were thankful for them for funding this project and having us to remind us that cultural, sports and heritage assets are important in terms of the social prescribing plan, right? So this project is also to find out how our patients are linked to these assets in terms of cultural, sports and heritage. And SLA is the solution provider behind this. And we're very glad to have Singapore Land Authority to advise us on this. So how did the collaboration with SLA work, right? We looked at the idea of it. We went to understand stakeholder needs and then explore various map solutions. So this is us, you know, a lot of, I borrow Cynthia's words, right? I learned a new word today. It's called blood, tears, and sweat. Yeah, in fact, it truly is, yeah. So this is the behind the scenes in terms of what we have done, but this is blood, tears, and sweat, yeah. So it's good that I'm in a dry fit t-shirt today. So a lot of discussions in terms of in-depth interviews, focus group discussions, getting to know what the stakeholders want. So these are a couple of our MCCY agencies. Yeah. So we've got the National Heritage Board coming, the National Gallery coming to tell us how do we then better connect them to the assets, and how would active aging centers be able to tap on these assets for the patients in the longer run. And for us, we were looking at perhaps a data administrator role. When these points are then mapped on the map, as an administrator, what do we do, right? So one of the things that we consider is that, yeah, perhaps when we are the data administrators, the group would then decrease as to how do we then consolidate and calibrate the information that we actually have on the map, and we need to have some editing rights, right? Again, pictures of BTS again. So we test-bed solutions, and then it was a very iterative process that we had with SLA. Yeah. So we tested out to make sure, because we've got a very diverse group of users, right? The practitioners are very diverse. We had to make sure that the UI of the inputs that the person will be making is user-friendly, people will be comfortable with it. Is it okay? You know, what kind of barriers were they having when they were using their phones to key in these assets? Are they working fine? So these were some of the stages that we went to. And yeah, so in terms of mapping solutions with SLA, so this is something that we've come out. It's based on an area in Sengkang. This is the prototype, and we hope to scale this up to the other parts of Singapore, and also for the use of many other practitioners in many other t-shirts like that, right? So thank you very much. My name is Adeline, and this is me doing Survey 123 as well, right? So with that, this is where my expertise in geospatial ends. I'm going to introduce my friend Wei Jian, who's in the Geospatial Data and Planning Unit in SLA. Thank you very much.
Thanks, everyone. So my name is Wei Jian. I'm from the Singapore Land Authority. Basically, what we do at SLA is we are the National Geospatial Agency. So one of our main remits is basically to uplift geospatial capability in Singapore. In that sense, basically, we were very happy that and honored that SingHealth basically came to us and worked with us to look into applications of geospatial into healthcare. Traditionally, this is not our main area of work, but we were they presented to us a very interesting challenge. Basically, they were new to geospatial, and they wanted to explore basically how they could use the technology to support their social prescribing initiative. So we had to address basically a couple of issues. How could geospatial technology help with data collection, data management, and data dissemination or even publication with an organization that really did not have geospatial infrastructure? there were key criteria as well that they gave to us. The data had to be secure because essentially parts of the data that they collected had personal details inside. So it had to be protected in a secure environment and basically ensured that there was not really public access to the database that was being collected. We also had to ensure that the data cycle from collection to publication had to be sustainable. In sustainable, we mean that the data would be easy to maintain. It was coming through a controlled crowdsourced methodology. So there were many people contributing or many parties contributing to the data itself. We had to ensure that there were feedback loops between the data collectors and the data administrators within SingHealth as well. So all of these type of processes were built into the whole environment or the whole process that we worked out with SingHealth. Lastly, the solution had to be scalable. So while the current study area was in Sengkang, basically, we had to scale up. We had to have potential to scale up the solutions, include more data collectors, and even expand the areas that were going to be covered in the future as well. So this project was very much in the exploration phase, and we needed basically solutions that were quick to scale up, quick to stand up, and were modular, so that if the solution was not appropriate or grew to be inappropriate due to changing needs and requirements, we could quickly pivot and change the solutions that were implemented in the process itself. Yeah. So primarily, we had to iterate along the way. So basically, the solution that we proposed and implemented was built on the ArcGIS enterprise portal. So it was based on, we used basically SLA's infrastructure primarily to ensure data security. So all the data that was collected would remain in our servers and not be exposed or accessible to by individuals who are not involved in the project. For the data collection part of things, as it required a lot of parties to collaborate, we configured a map-based web editor so that these using web app builder in a sense. So all of these tools exist within the ArcGIS enterprise portal for continuity and for easy transferability and communication of the data in order to enable the feedback loops as well. Right. So we created those the map-based web editor using web app builder, and we also created data input forms using Survey 123 as well. So there was a live feedback loop of data from when they collected the data, they can view it on a map, and they can interrogate the data on the map itself. Yeah. Data management was primarily done through the portal because data administration was meant to be quite light touch. It was meant to be a very iterative process with the data collectors on the ground. So we were able to just utilize functionality and tools within the web portal itself, to enable the data administration and publication. But for the last bit of things where we had to actually publish a web map for the welfare coordinators on the ground, we used basically the Instant app to create a web-based map that basically incorporated distance queries with basically simple location queries and filtering to basically create a very simple, usable interface for our coordinators on the ground to be able to use to consult with their clients. So all of these solutions were chosen because they are flexible. We could integrate, we could iterate, we could configure on the go, and basically we could deal with a lot of changing requirements as the project went along, and we found out new requirements or we met with new challenges on the ground as well. So this is basically what we did with Survey 123. So Survey 123 enabled us to introduce location data to the data that the data collectors were collecting on the ground on all the informal exercise or activities that people could participate within the community. So location was actually a very key element, as the neighborhood Tai Chi group would literally be in a basketball court or in a park somewhere. They don't actually have an address, so it's very hard to search for unless you actually map it out accurately. Right? So these are locations without specific addresses that we needed the data collectors to collect all of this information. And these activities sometimes can also shift from place to place. So the data collectors will actually need to walk their areas and find out, okay, is this activity still there? Is it there on Mondays, Wednesdays, and Fridays, but somewhere else on Tuesdays and Thursdays, for example, and tag those locations as well. So this enabled us to tag a lot of very valuable location information to all of the rich activities that are available in the community. We also took advantage of the face blurring functionality, basically, to add another layer of personal data protection when they were taking pictures of the activities on the ground. As basically we had to ensure that privacy was protected. Right. The forms were very easy to configure, and they gave us a lot of flexibility to use various forms of inputs, for example, multiple entry or even just free text entries, or selected, or give the data collector selected options, so to make the process of data collection and data entry as easy as possible. Right. And most importantly, it was compatible with most mobile devices. So we had no problems integrating this with iOS or with Android because the apps are available, and it ensured that basically there was accessibility for all of our data collectors as well. Right. So for data collectors, understanding the locational context on the ground was very important. So although they were collecting a lot of details on the forms, for example, that did not give them the spatial context and the locational context of all the activities that they were collecting. So creating that live loop from survey 123 back into a web map, we configured that web map using mobile editor, we should call mobile editor, using the web app builder within Enterprise Portal itself. Right? So this allowed the data collectors to view the data that they've collected immediately. They can, on the spot, basically look around when they're doing their weekly walks, for example, in the area, to identify what activities are ongoing. Do they actually have details of those activities? And are the details of those activities correct? So they can verify, they can locate, and then they can edit on the spot itself. And this enabled them to basically provide them more avenues to basically keep the data live and updated in a very iterative way. For data administration, that's where we have a team of data administrators in SingHealth that had a light touch role in terms of making sure that the data is accurate, making sure that the data that is put in is correct, for example, or even just ensuring that the details that are all fully inputted into the relevant details are there, available for the users itself. Right. So basically, we just kept it very light touch, and we just used basically the map viewers that were available within Portal itself for them to just quickly interact with the data, assess the data, and actually put in feedback to the data collectors itself, so that basically if there were issues with certain records, the data collector could then go back down to the site and rectify the data itself. Okay, so finally, when disseminating the data to basically their community of social prescribers or well-being coordinators, the final clean data had to be disseminated to them in a very accessible, interactive way. We basically used Instant App to generate an interface, a web-based interface that the well-being coordinators could use on the ground. They could very quickly query the location of their clients, identify the services that were within proximity of their clients, and then filter the services based on the client's specific needs, be it exercise, mental health services, or even social activities, in order to get their clients to go out and interact as well. Right? So they are also able to view images basically collected through Survey 123, for example, so that the clients are able to identify or recognize the signboards, the banners, or the groups on the ground, essentially, more effectively. Because the location on the map is one thing, but when you're actually on the ground, having that visual interface basically to recognize or to identify what you're specifically looking for is actually very valuable as well. Right? So in this way, basically, as the community collects the data and they view their own assets on the map as well in a larger database or in a larger community map like this. They're able to view their assets, and it creates a sense of ownership for them on the resource, and they are then further spurred on and encouraged to update that resource as well. So basically, when we were approached with this challenge, basically, one of the questions that we asked ourselves was, how could GIS basically add value to healthcare and to this social prescription initiative? We approached it in 3 ways. One was to ensure that there was accessibility. The functionality was easy to use, and it enabled the collaborative updating of the data, right? The next was basically, we had to view location as a key element in delivering this type of services. Because knowing what services were available is one thing, and there are many databases out there that have that. But where they are and where they are relative to you, basically is a very key thing when you're dealing with social prescription, when you're dealing with basically very granular services in your neighborhood or community context itself, right? And we had to look at the ability to scale as well. How were we able to switch between solutions or tools basically in order to scale up or scale down depending on the requirements of the project itself? So this allowed us to iterate on the go and very quickly react to changes in the scope, or even react to challenges that we met on the ground that we did not initially anticipate. So this is just the beginning. This project is still live, and we are constantly iterating, we are constantly improving, trying to figure out basically how to make things easier for the users on the ground to access the tools, or even to interface and use with the tools itself. We are constantly streamlining the processes so that the data admins don't have that much, as many clicks to do, or as many complicated processes to go through to publish the data. And we are always exploring the possibility of scaling, right? Can the solution be scaled to cover the whole of Singapore? Or can the solution be scaled to cover more areas? Can the data collection tools be scaled up to support more users, for example? So it's an ongoing challenge, and it's a very interesting project that we have with SingHealth, and we are very happy to be their partners in it. Thank you.